Good afternoon, everyone. Thank you for joining us. I am Dr. Jean, OBGYN at Pascack Valley Medical Center. And today we're going to be going through a few very common topics and questions affecting women's health. If you watching have any additional questions or comments, please feel free to share with us. We'll try to get through as many as possible. Okay, we'll get started.
How often do I need a pap smear?
How often do you need a pap smear? Current recommendation is a pap smear can be done every 3 years. However, if there's anything in your history that needs closer monitoring, you may be asked to come in every year. Please reach out to your OBGYN and they can kind of give you the best management recommendations.
Are there any immunizations that are important to get as women?
Are there any important immunizations for women? Yes. Currently, one of the most important immunizations is the Gardasil vaccine, which protects against HPV. That's not necessarily targeted just to women. Both women and men can get it. But in regards to women's health, your starting age is about 11 to 12, and there is a two-shot series, and that is strongly recommended for HPV protection. Other vaccinations that are important to get is to maintain your regularly scheduled vaccinations, which include flu vaccines, and if you're over the age of 65, pneumonia vaccine. If you speak to your provider, your healthcare provider, they can keep you on track with your schedule.
What lifestyle changes can women make to improve their health?
What lifestyle changes can women make to improve their health? Very important. You want to have a healthy, balanced diet and regular exercise. You want to maintain a healthy weight and a healthy BMI. You want to refrain from any smoking, and currently there is a large vaping use, so you want to refrain from vaping. You want to monitor your alcohol use, and you want to maintain your regular scheduled screening test. That includes the pap smears, the mammograms, and anything else that your physician recommends.
What is considered a normal range for a menstrual cycle?
Normal range, what is considered a normal range for a menstrual cycle? Normal range for a menstrual cycle can be anywhere from 21 to 35 days. Again, there are exceptions out there, but that is considered a normal range. If anyone out there feels that their range is outside of what those days are, contact your OBGYN, report to them what is your range, and they can go through your history and kind of guide you from there.
What are the common gynecological issues in women?
Common gynecological issues in women oftentimes are vaginitis or vaginal infections, most commonly a yeast infection, for example, any irregular patterns involving your menstrual cycle. So, whether it is too heavy bleeding, too little bleeding, um, very painful. Other common issues may be breast issues or breast abnormalities if you're doing a regular breast exam and you note it. Any of these issues should be talked about with your gynecologist. If you already had your annual GYN exam, make a separate visit to discuss any of these.
What are common menopausal symptoms?
What are common menopausal symptoms? Some of the common menopausal symptoms are hot flashes, vaginal dryness, trouble sleeping, hair changes, skin changes, and another very common one is weight gain. Many women report that there has been no changes in their regular activities, in their diet, and they find an increase in weight and trouble losing the weight, especially central weight gain. These are some of the common symptoms. If there is anything else that you are experiencing, it could also be related to menopause, which is important for you to have that conversation with your doctor.
Why are appointments for prenatal and postpartum journeys so critical for Black maternal awareness?
Why are appointments in the prenatal and postnatal journey so important for Black women? Right now, we know that studies show that Black women are at a very high increased risk of death, especially when it comes to maternal care compared to women of other racial disparities. Right now, that ratio is 4 to 1, and that is given even if we take into account education, income, social status, insurance status, etc. It's really important for Black women to maintain their regular visits, have a first of all, good relationship with their provider. You have to feel comfortable to have regular conversations with your provider. You have to feel comfortable to ask questions and to understand what your options are, what's the plan of care, and to understand where you should go if you need help. So, very important that Black women find that support system and have that open line of communication with their provider and maintain their regularly scheduled visits.
What are some important facts about maternal health for African American women?
What are some important facts about maternal health for African American women? Some important facts is that African American women are considered a higher risk group for many different reasons, um, whether it is from a maternal side, meaning if they had any pre existing conditions before the pregnancy, and going back to my previous question with their higher maternal death rate. Some of those important factors is recognizing your own health prior to looking to start a family, looking to get pregnant. If you have any comorbidities, you need to make sure that you visit your doctor regularly. You discuss how you can improve your health. You maintain a healthy diet, exercise, and optimize your health the best way that you can before looking to get pregnant.
Do forms of birth control help alleviate the intensity of menstrual cramps?
Do forms of birth control help to alleviate menstrual cramping? Yes, they do. There are many different forms of birth control out there. Some of the common ones is birth control pills, IUD, etc. And every one of those forms of contraception work differently. Each one has positive and negatives, and that's where a good conversation with your GYN provider comes in. And they can tell you which one has a better control of menstrual cramps over the others.
What are the common birth control types?
Some of the common birth control types, as I mentioned, are birth control pills, the NuvaRing, IUD, Nexplanon implant, and a few more. Each one of these work differently, and one may be good for one person and may not work for the other. So, having that conversation with your GYN provider, you have to see what you're comfortable with and what will help to help your specific needs.
Are there any ways to help alleviate hot flashes from menopause?
Are there any ways to help alleviate hot flashes from menopause? Yes. So there are a range of things. One is you want to look at some lifestyle changes. Sometimes decreasing your caffeine intake may help. There are some patients that have increased hot flashes if they have a little bit too much wine, for example. There are some more holistic aspects or natural supplements and treatments that you can use. And the other option is prescription or medical treatment where you can get from your GYN provider.
Are you accepting new patients?
Yes, I am accepting new patients. Again, I practice out of Pascack Valley Medical Center and I am accepting new patients. Okay, well, thank you. That's all the questions we have for this afternoon. Thank you for your questions. I hope you enjoyed this segment. Again, my name is Dr. Jean. I'm an OBGYN at Pascack Valley Medical Center, and I hope to have this chat with you again.